Lymphoma is defined as cancer of the lymph nodes. It is a cancer within the lymphatic system. It is also the most common blood cancer. There are two main types of lymphoma: Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma occurs when lymphocytes, which are a type of white blood cells in the lymphatic system, grow and multiply uncontrollably. It is often characterized by the presence of Reed-Sternberg cells. Here's a picture showing a Reed-Sternberg cell, which is overgrowing and much larger than the normal lymphocyte. These cancerous cells can travel to many parts of the body, like the spleen, blood, and bone marrow. It is most common in people between the ages of 20 and 34. Doctors aren't clear on what causes Hodgkin's lymphoma. They do know that it happens when an infection-fighting cell called a B cell develops a mutation in its DNA. Here's a schematic showing T cells versus B cells, but we'll talk about T cells more in just a moment. It tells the cells to divide rapidly and to continue to live. This causes an accumulation in the lymphatic system, and healthy cells are crowded out. There are subtypes of Hodgkin's lymphoma, with the most common being classical Hodgkin's lymphoma. Signs and symptoms of a patient presenting with painless swelling, fever, chills, night sweats, weight loss, and different things could be signs of Hodgkin's lymphoma. There are signs and symptoms. Risk factors include your age, family history, sex, and a weakened immune system. Hodgkin's lymphoma is more prominent in males. Here's a study done by New Mexico that shows the prominence in males. Hodgkin's lymphoma can be treated by receiving a form of chemotherapy and sometimes radiation. The other form of lymphoma is non-Hodgkin's lymphoma. It originates in the lymphatic system, which is the disease-fighting network throughout the body. It is also more prominent in males, like Hodgkin's lymphoma. With this type, tumors develop from lymphocytes, which is a type of white blood cell. This is the more common type of lymphoma. There are two main types of lymphocytes that develop lymphoma: B lymphocytes and T lymphocytes. B cells fight infection by producing antibodies that neutralize foreign invaders. Here's the schematic again. T cells kill the foreign invaders directly. Non-Hodgkin's lymphoma is divided into 4 stages. Stage 1, which is early in the disease, cancer is only found in a single lymph node or in one organ or area outside the lymph node. Stage 2, locally advanced. Cancer is found in 2 or more lymph nodes on one side of the diaphragm. Stage 3 is advanced. Cancer involved lymph nodes both above and below the diaphragm. And stage 4 is widespread. Cancer is found in several parts of one or more organs or tissues in addition to the lymph nodes, or it is in the liver or bone marrow. Like Hodgkin's lymphoma, doctors are unsure of what causes non-Hodgkin's. It occurs when the body has too many abnormal lymphocytes. Unlike normal lymphocytes, the abnormal lymphocytes don't die. They grow and multiply, causing the cells to swell. They continue to divide and crowd the lymph nodes. Symptoms of non-Hodgkin's are very similar to Hodgkin's, like swelling and fever and night sweats and unexplained weight loss. Some risk factors include medications that suppress your immune system, like after an organ transplant, certain viruses and bacteria, exposure to chemicals like pesticides and fertilizers, and older age. It is most common in adults in their 60s and most common in males like Hodgkin's lymphoma. Generally, non-Hodgkin's lymphoma is diagnosed and staged before treatment is chosen, but is based on that. It can also be treated by chemotherapy and radiation. Sonographically, lymphoma usually appears hypoechoic with some focal areas seen. Ultrasound is usually used to look at the affected areas and to find the best place for a biopsy. The best modality for diagnosing lymphoma is bone marrow aspiration and biopsy. This picture is showing a stage 1 spleen with an enlarged lymph node. This picture is showing a stage 2 spleen with enlarged lymph nodes and lesions. And this is showing an advanced stage, which is stage 3 of the spleen with enlarged lymph nodes and splenic lesions. And this is the end of my presentation.